Thank you for joining me today. In this video, we are going to talk about lithium, medication lithium. Lithium is a mood stabilizer and manic agency. So it treats manic and mood stabilizer. Is a mood stabilizer and maintenance, the gold standard for treatment and maintenance of a bipolar I. It is one of the few psychiatric medication prevent and reduce suicidal risk and widely used for manic episode in bipolar I and maintenance and as an additive medication in treatment-resistant major depression disorder. Lithium is FDA approved for acute manic episode of a bipolar I and maintenance of a bipolar I disorder. The common off-label uses of a lithium include additive in the treatment-resistant depression disorder and schizophrenia, schizoaffective disorder, and aggression and impulsive in a selective patient. Also cluster headache prophylaxis. So it prevents cluster headaches for neurological. Lithium mechanism include that lithium, the exact mechanism is not fully understood, but lithium is believed to be a model dopamine, serotonin, glutamate, and GABA acid neurotransmitter. Model for dopamine, serotonin, glutamate, and GABA neurotransmitter. So it affects all these neurotransmitters. Also, it inhibits the isolate monophosphate and reduces secondary messenger signals. It inhibits glycogen and synthase kinase 3, GSK3, and promote neuroprotective and neuroplasticity and reduces neurological excitability. Lithium pharmacokinetics, it is absorbed rapidly and nearly completely in the oral emission. No protein binding, metabolized, not metabolism, not metabolized. Lithium is eliminated in the kidney. Half-life of lithium is approximately 18 to 36 hours, longer in older adult and longer in older adult and patient with kidney damage. So so stay their body longer. Time to steady state about 5 days. So 5 days status. It is steady in the body 5 days. Therapeutic concentration of a lithium, clinical situation and target level. So it's different. If you want to treat acute mania, the level you want to get for lithium is between 0.8 to 1.2. For maintenance is 0.6 to 1. For toxic level increases, for toxicity level increases 1.5 and greater. Severe toxicity happens 2.5 and greater. Lithium blood level should be generally obtained 12 hours through after the last dose. If you want to measure the lithium blood level, you want to get the sample after 12 hours of taking the last dose. Dosage typically starts with 300 milligram orally twice a day, and you can increase gradually based on the blood concentration and clinical responses. Typical maintenance dose for lithium is 600 to 1,200 milligram day in divided doses. Extended release formulas may be improved stability. Baseline evaluation before a lithium initiation. Before you prescribe lithium, you have to obtain a complete blood count, comprehensive metabolic panel, BUN for kidney function, creatine, and EGFR for kidney filtration, thyroid stimulating hormone, calcium blood level, weight and body mass index, pregnancy test for the patient with childbearing potential, EKG for patients older than 40 and greater, 40 and older, or significant cardiovascular diseases and risk factors. Ongoing monitor for lithium include the blood level of lithium that you have to conduct every 5 to 7 days after the initial dose, or if you change the dose. And then every 3 to 6 months when the patient is stable and the level of the lithium is stable. Kidney function, you want to get that every 3 to 6 months for initiating the lithium, and then every 6 to 12 months if that is stable. Then you want to do the thyroid stimulating hormone and thyroid function every 6 months to 12 months. Calcium level at least once a year. Weight you want to do periodically. Pregnancy status, you want to do if or as the clinical indicated. Common side effect of the lithium is a GI upset like nausea, vomiting, and diarrhea. Neurological symptoms include, side effects include fine tremors, mild cognitive slowing, fatigue. Renal symptoms, renal side effects include, polyuria, polydipsia, nephrotic, diabetic insipidus. Endocrine common side effects include hypothyroidism, hyperparathyroid, hypercalcium. Metabolic, it increases the weight. Lithium increases the weight, so it has a weight gain. However, severe adverse effect, that's severe, that's risky, very risky. That is lithium toxicity, include lithium toxicity, severe adverse effect, severe side effects include lithium toxicity, chronic kidney disease, severe low thyroidism or hypothyroidism, cardiac condition abnormality, and then nephrotic, diabetic insipidus, which is hyperparathyroidism. Lithium toxicity, when it's mild, it is between 1.5 to 2, and the symptoms include nausea, vomiting, diarrhea, fine tremors, weakness, and lethargy. Moderate toxicity, which is between 2 to, when the level of lithium is between 2 to 2.5. The toxicity symptoms increase, and it's coarse, tremors, ataxia, slurred speech, confusion, hyperphalanxia. Severe toxicity happens when the lithium level is when lithium level is 2.5 or more. That is severe lithium toxicity, and the symptoms include delirium, seizure, coma, cardiac rhythm, low blood pressure, and kidney failure. How are you going to manage? You want to stop immediately the lithium. You want to assist the airway, breathing, and circulation. You want to also give the patient IV solution, isotonic solution, intravenous isotonic infusion if it's appropriate. You want to check the lithium level concentration and electrolytes. You want to obtain nephrology consultation when indicated. And hemodialysis recommendation is for severe toxicity or selective patients. Impaired renal clearance or persistent neurological symptoms, that's when you want to get the hemodialysis. Drug-to-drug interaction for lithium, that the medication that can increase lithium level include the thiazide diuretics, ACE inhibitors, herbs. All these are blood pressure medications. NSAIDs, which is pain medication, they increase the lithium level because the patient is losing water. Use cautiously with loop diuretics, metronidazole, metronidazole, dehydration, low sodium diet. However, the contraindication for lithium include significant, if the patient have a significant kidney impairment, if there is a known lithium hypersensitivity, for the patient have a hypersensitivity with lithium, if they have a severe dehydration, if they have significant sodium depletion. For lactation and pregnancy females, lithium is associated with increased risk of congenital cardiac malformation that include Epstein abnormality and Epstein abnormality, although the absolute risk is lower than previous believed. Decision regarding a continue during the pregnancy require individualized risk-benefit assessment. Lithium is excreted into the breast milk. So breastfeeding decision should be avoided. In a shared decision making and carefully infant monitoring if continues. So if the mother is taking lithium, that lithium can excreted into breast milk, and that will affect the child. So you want it should be avoided if that's possible for breastfeeding the child. You want to educate the patient about and teach them take a lithium exactly as prescribed, maintain consistent fluid and sodium intake, avoid dehydration, especially during the illness, exercise or hot weather. Do not stop lithium quickly without the medical guidance. Report vomiting, severe diarrhea, fever, excessive sweat, worries, tremors, confusion, and steady gait immediately. Keep all the lab appointments for lithium level, and renal and thyroid monitoring, because lithium level, thyroid and kidney function has to be monitored. So if the patient skips, you can't know what the level is. So educate the patient to keep the appointments. Inform the healthcare providers for the lithium therapy that the patient is on before starting any new medication. Lithium is the first line of mood stabilizer for bipolar 1 and has the strongest evidence for reduction of the suicidal ideation. Lithium level should be assessed after 12 hours of the last dose through for consistent therapeutic. Even a small changes in the kidney function, hydration, sodium balance can extremely affect lithium concentration. Fine tremors is the common and new course of tremors, and ataxia should raise a concern or for toxicity. So if the patient has a fine tremors that should, or ataxia, that should raise a red flag for lithium toxicity. Lithium is eliminated entirely by the kidney and requires dose adjustment and close monitoring if the patient with the patient who has the renal impairment. Lithium is a gold standard of mood stabilizer, especially bipolar 1. Thank you for joining me, and please subscribe the channel and join me again. Thank you.